Okay, so really impressive work. It's just an honor to hear from people who are doing such great stuff. What questions do you all have? We have about 5 to 10 minutes, I think, if there are any questions for the group.
Yeah, thank you so much for sharing all this information and for the work you all do. I guess a question I have, which I guess touches on your experience with Antonia, but I think this is more of a general question. Generally, patients that at least I've seen or heard from or experienced with other community health workers and providers, they obviously have a lack of trust sometimes with people in our professions, with providers. That can come from a lot of different sources. What, in your experience, is the best way to overcome that initial distrust so you can actually get to providing them the services that they need?
I think for me, one of the things, and this is something that I learned so early on, but, just sort of letting them into your world a little bit, maybe not sharing everything about your life, but really kind of, letting them know sort of a shared experience. I mean, it could be something as simple as, they say, oh, my birthday's in November. Oh, my birthday's in November. Just sort of kind of initiating that, something very small. But I think as you're doing these home visits and you're kind of meeting them where they're at, where they're comfortable, right? Because that's exactly what we want. We want them to be comfortable. We want them to be in an area where they could really open up. And a lot of times that is going to be in their home. But just sort of so they see that we do share some of those experiences. We do go through the struggles that they're going through. There's been times where I'm a single mother, and there's been times where I've had some struggles, and so I think that when you can kind of share bits and pieces, kind of initially, and even if they're within your culture, that you can share, my family's from the same place that you were born, or something like that. Something very small, I think, can kind of open up and allow that trust to kind of start happening, and then over time, you kind of really build that rapport, and I think that that's one of the pieces that for me has been helpful.
Yes, same thing. Most of my patients are fully monolingual Spanish speaker. So when I approach them with the Spanish, with the native Spanish, I think that's kind of, that's the first thing. That's very important. They hear you Spanish. They hear that you talk like them, and for many, I mean, I like Antonia. Antonia open up right away, because the way I was speaking to her, that friend kind of thing. We're not providers, and I think that's kind of make us different. They see you more like a friend, more like somebody from your community, and sharing personal information. I don't want to say I use my dad as an advantage, but I let him know that I've been through this. I've been through through the struggles of not understanding the information and having all these barriers, and they open up. Our culture is we're friendly. We just have to be friendly too.
Yeah, and I think too, just allowing them to be able to speak, allowing them to talk, because I don't think they have the opportunity when they're with their providers to ask all their questions. And because we're in their home and we have the time to allow them to ask their questions, to kind of say everything that they need to do, I think that in return, gives them that trust and that confidence that they can really open up. And so just letting them speak and kind of get everything out that they need to kind of allows you to build that trust.
Thank you so much. Firstly, I want to thank NKA for arranging such a beautiful session. It was very informative, and I hope that this type of session will continue in further meetings. So my name is Ashrafi. So I'm working to include community health workers in the chronic kidney disease care model in Illinois. So I have actually a few, two questions. So in the United States, I know not a lot of states are working with community health workers in chronic kidney disease care model. Only a few states are working on it, and I know I came to know about that. The Colorado and Texas are doing really great in this aspect. So my questions is that how many community health workers are really working in this field in Texas or Colorado, as per your knowledge? And are the numbers of community health workers working in the field are meeting the need of people really? And what training actually, the community health workers really received before they started working in the chronic kidney disease care model?
So part of my training has been one-on-one training with Tessa, with Dr. Novick. We've had sort of initial beginnings of training of just videos and really talking about that, but then also training of actual in-clinic training, so shadowing her, seeing how she interacts with her patients, sort of the information that's being provided, and that has been really helpful for me because I see sort of how the patients interact with Dr. Novick and vice versa, and then I'm also able to sort of reiterate some of the information that she's providing to them and sort of allowing them to fully understand what that means. Again, because of the time constraints, I think there's just a lot of information, and so when I'm able to go into a home visit and really do this education is sort of reiterating what she has provided for them and sort of the goals that she has. So that's the type of training that I've had so far with chronic kidney disease. But then I think just over the years of been working in clinical settings and hospital settings, it just sort of, I'm able to sort of incorporate some of that into my education.
Yeah, I also relate to that. I was an interpreter for 5 years, so I learned a lot of stuff over those interpretations. The community, or we have the public School of Public Health has the patient navigator training initiative, and they train for had to be a patient navigator with the motivational interview, and but then more than be curious, relate the questions of the patients and go with the doctors, with the experts. And how do you do that? How do you find out? I've been lucky to work with doctors at the dialysis centers, social workers. So my questions, when I have questions or when I needed more information, I will go to them right away, Dr. Cervantes, and I will have those connections to learn more, to give that information to patients.
But there is a real need for a nationwide sort of formalized training program for community health workers to work in this space. As Dr. Mercer brought up, our healthcare system is completely fragmented and impossible to navigate, and chronic kidney disease, kidney failure is a condition that is by itself extremely challenging to manage and navigate. And the opportunities for community health workers in the kidney disease space are huge. But to our knowledge, there's no actual kidney disease training program. It's something that we're maybe exploring, but there's a real need for that because there's a real need for community health workers in this space. So I think we've been really lucky, as you've seen in Colorado and Texas, or just in Austin really, because we've met community health workers who have experience, and we've added to that experience. But I think that a sort of comprehensive program that can be replicated is truly needed, so that we can encourage funders and policymakers to really invest and support this work. Yes, Roxana. Oh, she's from the Mexican consulate.
Okay, this is little. Okay, well, first of all, thank you so much for all the information that you provide, for the work that you do every day. Thank you so much. And more than a question, I just want to tell you how really we appreciate all the kidney screening, Dr. Tessa, that you are doing for the Mexican community, Latin community. And that is really important to continue to doing. We really have different persons that in time they know that the kidney start to failing, and they make some changes, and they have different results. So the last person that we have in this clinic that we got at the Mexican consulate was a young lady. She's like an LA 30s. And she was really happy because she went before another clinic. She started making some change, and now the kidney is doing good. So that is really, really important to really push hard all the preventions that we can do. That healthy clinic that we do, it's important. So everybody is invited to do more in the community. Everybody, when you know you can come, that clinics are for everybody. And just continue doing it. That was just, I want to say thank you, because we are really, really need to push really hard in that prevention. And I guess after you say you go with good work to do for try to more community health workers have that training, maybe like shadow with you guys, I don't know, but we need to do that. So thank you so much for everything you do.
So what Roxana, thank you. But what Roxana is referring to is, Roxana works at the Mexican consulate here in Austin, and the National Kidney Foundation actually does community screening events as part of the Keep Healthy efforts. They've been going on for years, but here in Austin they happen primarily at the consulate, and they screen people for kidney disease by doing urine dipsticks, and they do blood pressure measurement. You all might be familiar with this program. So what we did was we partnered with Central Health, the organization that Evelyn works for, and Evelyn, when people were found to have protein in their urine, helped them get connected to care by signing up for medical insurance and getting connected to primary care and nephrology care if needed. And there was great, incredible feedback from people who participated in that program, and it's just a true example of how we really do need to go into the community, because and meet people where they live, where they work, where they worship, and in order to truly prevent kidney disease. So, but thank you, Roxana.
Thank you.
Any other questions? I think we have time for probably one more. Yeah.
Thanks so much. I appreciate your work and your presentations. I know a lot of the services you provide are in Spanish, right? And maybe some in English as well. What I'm curious about is whether you feel like you have resources available in person or tablets to provide those same services in other languages that are not English or Spanish.
Yeah, so I try to hand sort of folders with some of the education that I provide, and along with it is a list of resources, and it has, it is in English and Spanish, but it has a line where they could get information in different languages. So that is included in sort of this toolkit, if you will, or packet that I give to patients. Is just providing these resources. So that's housing information, that's food insecurity, transportation, COVID information. So yes, we do. And then if for any reason there's a particular language that's not included, I definitely try to provide that information. I carry my laptop. I have all my, so that I'm able to research that while I'm visiting with them.
Yeah. Well, right now, we just work with the Latino population, so we don't need, but organizations have the language line. So if I have to talk to somebody that is not in English or Spanish, then I will utilize the language line. Yeah, but our goal is kind of meet all the communities and have all this information in all the languages.
Great. All right, well, thank you so much for joining us today. Really appreciate it. And thank you to all of our speakers.